Hello everybody, I'm from Portugal, Lisbon. It's a very pleasure to be here. Thank you for the invitation of Dr. B and Gina, is a good friend. It was a very exciting moment when she called me. I'm pleased to be here to be able to talk about my technique, the WCC 3D rejuvenation. To begin to explain this, most of my patients, when they came to my office, they want just like this. They told me, "Doctor, I want this." And when they do this, I always see the face of them moving and talking with me, and I always see laxity. I see the face like this, and I search laxity in their face. They always ask me not to volumize, but to treat the wrinkles near... To treat the wrinkles near the face, but to treat here, indirectly, I have to treat other structures. Let's see. So in the first consultation, I ask the patient what they need in front of the mirror. Talking with them, I do the evaluation, the time of aging. I ask blood samples and thyroid functions, and I make a plan. I treat essentially, directly, flexity, and I obtain an indirect, invisible lift. I do volumization, toxin botulinum threads, laser treatment around the eyes, around the mouth, the spots, and do tightening. To explain more my technique, I have to speak about facial aging process. We know that facial aging is a multi-factor process involving the bone, muscles, fat loss, and ligaments and derm, that affect these all structures that are interconnected. With the aging effect, aging of the face is a 3D process which involves bones, muscles, adipose tissue, and skin alike. The 3D process caused by a number of factors, which include the effect of gravity, proptosis and subcutaneous tissue, collagen atrophy, and HE decrease. We have sometimes atrophy and hypertrophy of adipose tissue and bone reabsorption. So for the bone, let me see if I told him, the bone and cartilage structure become visible as the skin and subcutaneous tissue get thinner. The structure of the skin is alterated and convexity turns with concavities and give rise to a process which is called skeletonization. The process of bone reabsorption prevails over the formation of new tissue. The progressive reabsorption of jaw bone that you can see here of the aging can lead to development of hypoplastic chin and the formation of a frontal mandibular furrow here. Moreover, it is possible to witness inelasticity that can be more prone in some patients than another. So when you have the aging, the process of aging depends on your family. And the presence of alteration of the textures of the skin and muscle relations can appear previously or more later in your life. As time goes by, the fat tissue is redistributed, you know, and they become thinner, and the face will lose the fullness with the age, and distinct compartments can be separated, and with them the skins go down. We can see the evolution of the face from a triangle to a square. So the big problem of my patients, it's the kink. I named the collagen loss. So the middle layer of the skin thins due to collagen loss. We see here a collagen in a youth skin and a collagen loss in an Asian skin. Here, from here to here, we see the fibers, collagen and elastin, that were vertical, and they begin to be horizontal. So with decrease of the collagen with aging, elastin and HA decrease, we can see the lines, the wrinkles, and the folds on the face. So, with dermal aging and collagen loss, the aged skin undergoes several changes that includes, and we can see on the face, all of them, or 2 of them, or 5 of them. It's the reduction of skinniness, or not. They can be a skin very tight. You have, a drier skin or acne-prone skin. You can have a loss of elasticity, more prone to wrinkle and sagging, increase in pigmentation, color changes, large pores, asymmetries, and a sad looking. So, with all of this, I would like to explain that with an increasing understanding of the aging process and the rapidly growing interest of minimal invasive treatments of the patients and ourselves, and the development of different fillers and biostimulator, I have changed my perspective of treatment. Before that, I used to divide and treat the face in 2 areas. But now, the way I see the things, I'm changing, and I don't see like this. I would like to speak about and explain better with classification of Thierry Bessin. Thierry Bessin divided the face in 3 areas. The pro-face, sector 1, the mesoface, sector 2, and sector 3, the metaface. What they teach us is that in the pro-face, there is a time sliding sector. Why? Because in this area we have a poor structure of bones and ligaments that anchor our skin. But these soft tissue are not supposed to be are not supported by efficient ligamental structure, neither has bone support, and so more prone to ptosis and additional laxity. So I began to think about this, and when I was injecting, I mental saw this area, and I thought probably it's not a vertical area of ptosis or prone, or we have where we have not efficient ligamentous or area of less bone support. I named twilight zone a different zone like this. When you open your mouth like this, you can put your finger in and you can see that in this area you don't have bone support. You have muscles, yes, more aging. You have ligaments here, more aging, and the dermis lost the collagen. So I began to think, when I was injecting, one time I tried to inject in another way, so because my patient don't want to volumize. In fact, when you want to treat this area, you begin to treat here, to do a lift. But if I told them, explain this in front of the mirror. They will tell me, no, I can't, I don't want. You have to have another technique. So I began to, technology. I began to inject this way and treat all that area in a different vector. It's not volumize, it's injecting the way you do an invisible lift, because you are going to stimulate the collagen of that area without volumize. So you're going to give elasticity and treat the flexity, and indirectly you have an invisible lift. How I've done this? Because they want something that lasts forever. So I try for 7 years. I will try different techniques, and I create WCC collagen stimulation. So I began to use LNC. LNC is a biostimulation that I put on the skin. It gives the immediate correction, provides immediate feeling and recon correction. You see, I use a cannula of 25 gauge, and indirectly with the stimulation of the collagen, I have a volumization of the specific area near the mouth because they stimulate the collagen. Biostimulation, when I inject the CMC gel, is gradually reabsorbed by macrophage over the period of several months and weeks. During this time, the microsphere stimulate neocollagen to replace the volume of the reabsorbed carrier. This mailing type 3 protective collagen as other fillers, you know, they want here, they want, and they get this. The injecting technique is a facial treatment. I inject in the deep dermal and subdermal with fine threads, linear threading, feigning, or cross-etching. Always inject slowly. I gently mold that area, and gradually it brings the treatment to correction. I don't do bolus injector in some sites, but these techniques you can inject not more than 0.1 or 0.2 milliliter to avoid any nodule formation. But I don't do bolus. I only inject with linear. So this is a clinical studies of the efficiency of the biostimulation of LNC, and then with this I can treat the middle face, the mental crease, the jawline, all these areas with this type of biostimulation. But I use mainly here in my technique. So I sit the patient, I see the flexity, I see the wrinkles, I see what she wants, and I draw where I want to inject. Sometimes I inject the jawline, sometimes I inject here. I do 2 or 3 sections of biostimulation. So I treat all that area of flexity. So when she smiles and she gets sad, we can't see the wrinkles here. They want to treat here. So I associate another technique, the laser ProDeep. Laser ProDeep is a fractional non-ablative laser, neodymium with these nanometers, and these lasers have a more penetration and without side effects. Coagulation effects are more intense, and more intense is the coagulation, more intense the thermal damage. It's a platform, Etheria platform, with this pistol. It's neodymium. We have, I treat with milligrams, 400 MTCs for centimeters. These lasers, we have an ablation with complete removal of epithelial layers through the superficial vaporization effect. And it's going to do an inflammatory effect in that region I treat, tending to reach deeper layers of the tissue. So we can see in histology, we have a thermocoagulation column and then a shrinking of the tissue. This is our clinical studies. And the laser, how I do the laser. I have just a little bit a video here. So you can see I use cryo to use energy. They're going to be just till 200 joules. I can do all full face or just the zone, the twilight zone I want. You can see the area can be like this, fractional. There's no downtime. The people come just little red for 48 hours. They put some protocol of my own, and they don't have downtime. I use LEDs phototherapy to the skin get more less red and to be fine in a few minutes. So I do 2 cycles of LEDs. These are the results. So when the patient arrives here, she wants to treat to be better here, better here. She wants to be better here. This is the result after. Before, she has this. And I have to say that the people, here we have a photo, a fixed photo. But when they speak with us, they move. And we see the sagging, and we see the wrinkle. And here I have a static photo. It's not the true, because when you see the patient needs, you see the lack of elasticity of the skin. So in all these patients, I do the WCC 3D treatment with laser Pro Deep 3 sessions each month, and then I do biostimulation 2 sessions after the laser. This one patient, the second patient, she wants to be treated here. Third patient, 48 years. I've done Botox too. So WCC treatment is a combination of 2 treatments for invisible 3D lifting. Laser Pro Deep 4 sections each month, and biostimulation with LNC 2 or 3 sessions depending on the flexity. I can do combine if they want volumization with hyaluronic acid, toxin botulinum, anti-aging phototherapy with LEDs and threads at the end. Thank you very much.
Dr. Alexandra, so I enjoyed your presentation because I'm working with Dr. Gina together, and we love everything what is good for anti-aging. And I was wondering of the type of the patients, so what is the ideal candidate for this procedure?
The ideal candidate, it's not I've done all kind of people this technique. But the ideal candidate is the one that has flexity. When you put the hands like this and do flexity, you have a laxity, very hard, and sagging here, and some wrinkles. So it's not the patient that has lost all the volume on the face. Just they say, I had a diet for 10 kilos, I'm like this, and you are treating the skin. They get very better, fabulous treatment. They get tight, okay? So we have an indirect invisible lift with this combination of these two techniques without volumization. We treat the jawline and this area that you don't have the support of the bone or ligamentous zones. So it's wonderful.